You see, you don't say, so how are you doing? Because that's a loaded question, because she'll say, I'm still having headaches. So I would have said, okay, so what number headache are you having now when you wake up? Because that's where I want to start, because the primary target is upon waking, and then you go from there. So what number headache do you have now when you're waking up?
I had a 2 this morning.
So is that unusual for you?
Yes.
So the goal is why would this gal go from 4, 5s, and 6s in the morning to a 2 every morning? I'm thinking, you know, I have a feeling that the intensity of clenching might be less, but it's not enough to get her to a 0. And let's say, and you look in them, and you put your device in, you don't have to do that, and then you go like this, and you look around in there, and you go, I have no posterior contacts in excursive. I have no canine contacts in excursive. She can't get in front of it. She can't get behind it. The last option, now I just went through all the horizontal movements. The next other move is vertical. And I go, you know, let me see your teeth. She's got sharp, pointy everythings. This person doesn't grind her teeth. She's too busy squeezing. So I think I'm going to increase vertical now. So if she says, oh, I wake up, I say, tell me about the headaches. You wake up in the morning, she says, oh, I don't get headaches anymore. I still get headaches. The whole point of asking about the number upon waking is to find out if she's starting out at what number compared to what you first recorded. And then she'll, I'm still getting headaches when you get them, or 11 o'clock, or whatever it is, and that's when you start considering whether or not she's using a daytime device, whether she needs to. There are some migraine patients, though, they say, no, I wake up feeling fine. It's just the weirdest thing. And then I go to bed feeling pretty good. And when I feel a headache coming on, I take 2 Excedrin, and it poof, goes away, and I finish my day. You don't have to get a daytime device. So you can still titrate it. You're still observing, and it's the method of questioning is what you're fishing for. One more thing. Go like this. How far can you go out? Squeeze a little bit. Squeeze really hard. Can you?
That's it.
Okay, don't do it anymore. Her jaw goes out and a little bit to the right. When she does that, it has a real nice, stable CO like this. Where's the other pain you always get, like a baseball bat hits you?
It's in the back of my head right here.
On that side. So when your jaw goes this way, you have a pain in the back when you squeeze. When your jaw goes that way, she feel like there's a baseball bat back here. And her teeth are still pointed, but then again, she has practically no incisal overlap. There is no anterior ramping. She just flies out there and clenches because she can. Some mornings or some nights, she's probably clenching like this. As goofy as that looks, what would happen if someone actually did that? They'd have this unfigure-outable posterior back of the neck baseball bat in the back of the head headache, which she's had for a long time. Mm-hmm. And what have you had done for that?
Nothing. Nobody can tell me why it hurts back here, here, all along this muscle here. And why is it only on this side? Because I'm moving my jaw.
I think is when you protrude, your jaw goes that way to clench, so the balance is from the other side. So you've got to pull your head back that way. So seeing that, and in your exam, you've asked about, do you ever have like a weird sinus problem? Mm-hmm. See, I haven't asked her that yet, but a protrusive clencher would have a weird sinus problem because the lateral pterygoid's got to pull the jaw forward in order to clench forward. And once it gets pulled forward, it just pulls backwards on the pterygoid plate. So you have a weird kind of a sinus condition?
Yeah.
Which is?
Oh, it's just this cheek hurts. The whole cheek will hurt. It'll hurt here, up here, here, inside the eyeball, like you want to gouge your finger in there. When my headaches start to get worse.
Is it simultaneous with your neck pain?
Oh yeah, it's like the whole package. It's like if I could just lop off the whole left side of my face, I could feel fine.
In order for her jaw to protrude and go to the right, the left lateral pterygoid is what's pulling it forward. So you would expect left facial symptoms, left posterior neck. And is your headache one-sided or not?
Yeah.
Which side?
Most of the time, left.
So it's just full-on squeeze fest on that one side. It's like this non-working excursive kind of a deal. So when you've asked those kind of things, you ever have unusual sinus conditions? Don't say sinus disease, sinus, just say unusual sinus, and they'll just start telling you stuff. You ever have like a stiff or sore neck? Oh, God, I have a baseball bat, blah, blah, blah. And so then I'll say, make your jaw go like this. And they do. And I say, squeeze real hard, and they can. And it wouldn't be weird if they did that. And so now I know when I make my NTI device, I'm going to check for protrusive and make sure she can't get in front of the bump. So that's the kind of stuff you're looking for. So when she comes back in a month, says, I thought it was going to work for me, but it just isn't working anymore, man. I have to go to the chiropractor because I got this neck thing. It's degenerating C6, and they give all these great terms. And they put in a device, and I say, make your jaw go forward, and flap right in front of it. What else do you want to talk about?
When I would go see my chiropractor, I'd see her like on a Monday evening. The next day I'd have to go back to see her because my neck was even worse, and she'd always ask me, what do you do in your sleep? I'm like, I have no idea. I wish I could stop doing it, so maybe this will.
Now, my experience is that when you ask a patient in a dental office, do you have headaches? The experienced headache sufferer will say, nope. Because if you say yes to the dentist, he'll say, well, maybe you need a occlusal equilibration. Maybe you need a TMJ splint. Have you had your MRIs of your joints? You could be I see a neurologist. I don't need your crap. Because that's what the headache patient is thinking, because they've been there, done that. That's why we can casually say, oh, and you're like, ooh, you wake up, do you usually feel fabulous? And the patient goes, well, that's it, you're in. The hesitation was it. And then you can swing around behind the patient, you push right here. How bad does that hurt? They go, it doesn't. And they go, I think the dentist might want to give you a brochure on something. End. And then all of a sudden the dentist comes in and he goes, yeah, let me see when you press. Wow, feel that thing bulge out, you know. Here's a brochure. You might want to consider that. Done.